type 2 diabetes, I know, is a disease that can be controlled. Diabetes, once it's identified, it is important that people understand that the complications can be very chronic. And those are the complications that I stress to people that we need to look at to prevent. And it is a process. It is a process of identifying, is it the foods that I'm eating? Is it if I am on medication, am I taking my medications? Do I exercise? Physical activity is something very important that we know in diabetes will help control the blood sugars. We start with an assessment. We start with a lot of personal questions. We want to find out, do you have a lot of stress in your life? How do you deal with this stress? Do you realize that if you have stress in your life, it's going to raise your blood sugars? By nature, the body responds. So once I do the assessment, and it takes about an hour and a half, then we do provide them a meter. The doctor wants them to start checking their blood sugars, and we explain the reason and the rationale of the numbers. And I know people are afraid of poking their finger, but we show them little tricks that helps them. It doesn't hurt as much if you do it a certain way. That will help them have a little better understanding that they need those numbers in order to treat their diabetes. We see their numbers changing. As you know, in diabetes, we do a lot of blood tests, one of them being the hemoglobin A1C, which is the 3-month blood test that the patients are asked to do. And initially, they're very high. They can be 11 and 13%. It runs in percentages. We want that number to be between 6 and 7%. When they come to us, we explain to them what that number means. We give them handouts specifically saying, this is where you are, this is where you need to be, this is what will help you bring it down. But otherwise, we're going to start being up there or going up, and medication is going to be increased. And you're telling me you don't like to get insulin. You don't want to get, you're barely taking your pills. And if the blood sugars don't come down, then we have to start the medication to prevent the complications we know that can happen. People see their family members, and they can see that, well, they got treatment, so they're still alive, but they don't realize that they have so many complications, underlying complications that may surface up later. They have no concrete information. They may pick up information from their neighbors or family members. And for instance, if they're going to be started on insulin, I don't want it because my grandmother died when she started on insulin. Or misunderstandings that they don't really understand the disease. And I wish people would really sit down and learn about the diabetes, how it can be treated and prevented from becoming very complicated conditions. I show them their number. I show them, let's say they're pre-diabetes, they can be between 6 and 6.5, their number. And I'll explain to them if within 2-3 months this number will go up. What will help that number to bring it down will be planning to eat appropriately, creating a routine in their lives. It's important for children in school, teenagers, learn about diabetes because it is a disease that can be controlled. It is a disease that a lot of times we see it from parents coming down to the children. It is a disease that you can control with diet and exercise. It is a disease that the more they learn, the more they're able to put it into practice, to eating appropriately and maintaining that balance. I like being a nurse and a diabetes educator. I've been a nurse for 40 years. I've been a diabetes educator for 12 years. And so I have learned about diabetes, that it is a disease that we control. Basically, that I have been able to maintain it myself, and that I know that it is a disease that can help the individual live a healthy life. We work with individuals. They're patients, individuals. We also do diabetes classes, and they're groups. The diabetes classes here are 10 hours, and they come once a week all week long or once a day for 5 weeks in a row. And so we teach them about diabetes, 1 hour with the nurse and 1 hour with the dietitian. So it's 10 hours total that they get as a group. In diabetes, it is good to include the social worker for issues that the patient may need help with. The pharmacist also, that the patient understands and is comfortable with the pharmacist asking them about medications over the counter and medications that they're taking. It is also important that spiritually, if the person knows what their needs are and if they have a connection with their own spiritual advisor, that is also something that we encourage. And then it's the team, the doctor and the nurses and the dietitian also, that help the patient with overall the nutritional needs of the individual. I bring my own personal experience of having had diabetes and having to dominate it, being able to control it. And I know that it can be controlled because I've done it. It takes a lot of patience and encouragement and understanding and education. Wouldn't be here if I hadn't learned about diabetes. A routine day, I can either have classes. I can have a class that can last for 2 hours from 9 to 11. I do the classes in English, and I also do the classes in Spanish. So there's 2-hour classes. I can also do the meter classes. We have large groups of people teaching them how to use the meter. We just don't give them the meter. It specifically takes us an hour to teach them how to use the meter because we want them to use it appropriately and feel comfortable with it. I also see patients one-on-one. Then that's when we do the assessments and identify their needs. So those are my daily routine. I became a nurse. I took care of my dad. When I was 20 years old, he became ill. And way back in the 60s, we were the ones who were in the hospital changing and feeding them. So I became, I liked helping people. And so this is about helping people. To become a registered nurse, you have to get your college hours, and then you select the field that you want to become after 4 years or I went to the 3-year program, the diploma nursing, and I worked in the hospitals. So that's the experience that I got. I worked different departments. I've been a nurse for 40 years. I worked ICUs, MICU, recovery, the floors, so psychiatric floors. I also worked substance abuse, so I learned a little bit about nursing in all aspects. With diabetes education, in order to become certified, they require for you to see at least or more than one patients, 10,000 patients. You have to have a lot of patients. 1,000 for the requirement. Then you have to attend so many hours of training, and then you submit that information. And then you go for the test. You become certified, and once you pass the test, then you became the certification as a diabetes educator. In diabetes, one of the tools that we use is a monitor. And it's important that patients learn appropriately how to test their blood sugars. Know that their tool is very important to let them know how their blood sugar is. Testing the blood sugar is the best way to identify where their blood sugar is at. And the doctors utilize those numbers in order to provide treatment, either to increase the medication or decrease it. Blood sugar meters are important that the patients learn how to use. I know there are a lot of meters out there in the market. It's important that the meter that they have, that the meter that they're going to use, that they know how to use it appropriately. What does that number mean? Why is the blood sugar high? Why is the blood sugar low? And then be able to have information from the doctor as to how often to test. I always encourage patients to know what is your first symptom of low blood sugar, what is your first symptom of high blood sugar, and test your blood sugar and identify how that number is going to help you determine where are you with your diabetes. When we do assessments on patients, we start looking at their physical activity. And I always tell patients, tell me what you do. When do you walk? How much time do you exercise? So what I tell people, it's important that if you're not used to exercising, I don't know how your heart is. So I don't want you to do a strenuous work, to do a lot of physical activity right away. You're going to go walk for an hour at the mall tonight. Tomorrow, I guarantee you will not be able to get out of bed. You're going to be so physically tired and achy, you're going to say, that nurse was crazy. I'm not going to do what she told me to do. So what I tell patients, I prefer you start slow. 5 to 10 minutes after a meal, after breakfast. 5 minutes back. No shortness of breath, no pain. And continue doing it. Then for about 3 or 4 days, then increase it to 10 minutes going and 10 minutes coming. That's already 20 minutes. And if you do that 2 or 3 times during the day, you're adding up already, 30, 40 minutes. That's going to have an impact on your blood sugar. It's going to bring down the numbers. But the secret to it is consistency. You have to do it every day. You have to plan your exercise. You have to say, I'm going to